Hello and welcome to today's video blog. My name is Carl Conley. I'm Chief Technologist at Netmaven. And Netmaven is a 5G consultancy partner. And I'm joined today by Dr. Neil Kudler from Pixel Health. Dr. Neil is the Chief Medical Officer at Pixel Health. And Pixel Health are one of our partners, and they're primarily focused on delivering IT solutions to healthcare. They are experts in consulting, and with staff like Dr. Neil on board, they certainly understand the clinician's perspective when introducing new technologies. So I'm very happy to welcome back to our video blog series, Dr. Neil. Thanks for joining us today.
Great to see you again, Carl. Thanks so much for having me.
All right, Dr. Neil, today's blog is all about the quadruple aim. But for those who aren't necessarily involved in healthcare per se, can you help the audience understand, first and foremost, what is the quadruple aim? How did it come about? And why is it such an important framework for healthcare?
Sure. So the quadruple aim actually has its origins in what was a seminal article published in 2008 in the journal Health Affairs on what was then titled the triple aim. And those three aims at that time really circumscribed what were seen to be the major categories to execute strategically. The first of those is about the patient experience and their clinical outcomes, really making healthcare delivery more patient-centered and assuming for the patient's perspective, especially with regard to navigating the health system, having some sense of health literacy, preventative health and monitoring for future events are all part of that patient experience arm of the quadruple aim. The second arm is population health, and really this is taking that individual patient and now expanding into the public health milieu, whereby efforts are made to make care more accessible and equitable for all populations. A lot of this work really is based on data and data analytics. So the aggregation of data points ranging from clinical to demographic and a whole host of others, as you might imagine, to analyze that for meaningful information whereby meaningful interventions can be designed to address either deficiencies in care delivery or areas that are just new and calling for attention. The third aim is sometimes called bending the cost curve, and I think the easiest way to think about bending the cost curve is as an equation. Not that I'm a math head, but if you consider that the value of your healthcare is equal to the quality of the outcomes divided by the cost of care. So how much juice can we squeeze out of the healthcare dollar? We need to squeeze more because we already know that the United States spends almost twice as much as the next most expensive industrial nation on healthcare. And yet we do not get the results for the dollar. That is the meaning of bending the cost curve, driving results for the dollar invested. Now, we are talking about the quadruple aim, and it was not long after that paper was released that folks recognized the absence of the provider, the clinician, in this calculus. And so without attending to the welfare and well-being of our frontline physicians, nurses, nurse practitioners, and other direct care providers, we will not be able to receive the care that we so desire. So it's really a matter of creating a culture of well-being, offering efficiencies that reduce administrative burden, and ensuring that that providers are having fulfilling careers and in the way that they spend their time. Now, those are the four aims of the quadruple aim. What makes this so important? Well, let's just say what it is. It's all about improving care delivery to our patients. And so that's what patients need is equitable access and service that is also affordable and yields meaningful results. So the quadruple aim holds that principle. It also accounts for the critical strategic inputs of most healthcare systems, um, from patient safety, quality, and clinical outcomes to recruitment and retention of the best and brightest clinicians to the populations that they are treating both in the exam room and at large. Hospitals do not live, health systems do not live as islands. They are deeply embedded in the communities within which they exist. The AAA also emphasizes the importance of value. And I've already mentioned how the dollar value is critical to the way that we do our work. And then lastly, the quadruple aim really underscores the importance of continuous improvement, innovation, and collaboration, just to mention a few cultural impacts. So thank you.
Neil, thank you so much for breaking that down. You've made it very easy to understand, and certainly I definitely appreciate, as I'm sure the audience does, an actual practitioner's view of the quadruple aim. So, to that point, Neil, how important is the quadruple aim in the decision process of a clinician when they want to introduce new technology or advocate for something transformational like 5G? And the second part of that question is, what are the pain points that doctors may face when trying to make the quadruple aim a priority in that decision process?
I wouldn't say that the quadruple aim is on the minds of frontline providers. Depending on the particular interest of the individual physician or nurse, they may have no awareness of this formal set of principles. However, those who do become involved in decision making, who enter into leadership roles most certainly will be intimately familiar with the quadruple aim. As I said, it really does help to shape a health system's strategic objectives. Now, the pain points. In thinking about something like 5G or any system-wide technology with 100% impact, we've got to think about what problems we can solve. Provider burnout, administrative overload need to be addressed through an implementation of a technology like this. How do we solve problems with fragmented care delivery due to poor communications and coordination? Uh, Something like 5G can certainly help fill gaps where interoperability and information exchange are failing. The lack of data transmission, whether due to connectivity, volumes of data, or remote distance, really can be addressed by a technology like 5G. And then ultimately, what we're trying to do with the quadruple aim is to close healthcare disparities, whatever those disparities may be. And this can be done by spreading the access to care to a virtual space, a remote space that would previously not been imagined.
Now, Neil, the blog that we've written together really focuses on delivering better patient outcomes. So let me ask you, from your perspective, how advantageous is it for healthcare organizations to employ 5G to improve population health and patient outcomes?
I have to say, Carl, I think the implementation of a system-wide private 5G network is the most exciting thing since we put T1 lines into the office back almost 30 years ago. The ability to connect and collaborate electronically will grow exponentially, not only because it fills in gaps of connectivity, but because of the speed the reliability, the low latency of those connections, and what we all care about, security, will be maintained. And that's just huge for communications and collaboration.
Great insights, Neil. Thanks a million. Now, clearly, our blog is focused on the quadruple aim, and you've kind of touched on this already with respect to cost. But I really want to ask you about the value of every healthcare dollar spent and how much of this is a factor when an organization is contemplating or introducing a new technology like 5G, which is very transformational.
Well, again, any major expense needs to account for return on investment. In healthcare, when we think of ROI, though, we're not necessarily thinking a dollar spent is going to give us a dollar 10 return on investment. What we really want on that dollar is to fatten up its value. I'm not going to put numbers to it, but we want to improve the quality of care, ensure the safety of the patient as they navigate through the system, have standards of care and standards of effectiveness to ensure that the right patient is being treated in the right place at the right time with the right protocols. And 5G can ensure that on a host of different levels, from the ability to collaborate in real time to the ability to store and transmit data ubiquitously, and to be able to see patients remotely because of the safety, security, and stability of a 5G network.
All right, well, that's it for today. I hope you've enjoyed this video blog. We're intending to really bring the blog to life by having a subject matter expert like Neil, who's a clinician, a chief medical officer, really speak to his peers when they're thinking about something as transformational as 5G. And if you want to learn more about Pixel Health, go to pixelhealth.com or netmaven.tech. We're more than happy to engage with you around any questions that you might have to see whether or not 5G is a potential fit in your organization. Thanks a million. Have a great day.